Welcome to Nova Academy. My name is Alex Krasser and I'm head of online learning. We're very excited to present the Pandemics and Public Health Initiative designed to help teens around the world be better informed about one of the most impactful events of the modern era. The COVID-19 pandemic is an unprecedented challenge to our modern systems of healthcare, our economies, and our systems of governance. What medical sciences are we leveraging to fight the pandemic? How are we doing? And what can we do to protect ourselves moving forward? To help us answer these questions, we're very fortunate to be joined today by Dr. Felipe Fregni, the director of the Laboratory of Neuromodulation at the Spaulding Rehabilitation Hospital, a physician, and an Associate Professor of Epidemiology at the Harvard T.H. School of Public Health. Dr. Fregni, thank you so much for taking the time to join us today.
My pleasure. Thank you for having me.
So in a few words, could you introduce yourself to our students and describe a little bit of your background?
Sure. My initial sort of a training is on medicine. I am a medical doctor. I did my initial training in São Paulo, Brazil, where I'm from. Did my residency in neurology there, did my PhD there, also University of São Paulo, moved to Boston. I've been here for about 20 years. Initially as a postdoctoral fellow at Beth Israel Deaconess Medical Center, one of the teaching affiliates of Harvard. Continued, did few master's programs here at Harvard, and then became faculty. I think that was initially in 2005, junior faculty member, and then now I'm an associate professor at the T.H. and a professor at HMS. And I run a large laboratory of clinical research looking for new techniques to enhance neuroplasticity. So together with my interest in the sciences of clinical research methodology, that's where I teach at Harvard T.H. School of Public Health.
Well, you've been a very busy man. Thanks for fitting us in. So going back to the beginning, was there sort of an aha moment where you realized that you wanted to become a doctor?
Yeah, that's a good question. So I think was medicine. There was a lot of it was a mix between intellectual curiosity. So in terms of there's so much we don't know, so much we wanted to study. Plus, it is something rewarding. So you're doing something to help others, and for me it was the perfect combination between putting yourself in new challenges, intellectual challenges, and at the same time, so what you're doing has a direct impact on people's lives. In the medical school, it developed my interest in clinical research and investigation. Now, I'm a full-time scientist and teacher here at the medical school and the School of Public Health.
So I see that you're an expert in evidence-based medicine. I personally would like to think that all use of medicine is based in evidence, but could you describe what evidence-based medicine is exactly?
Yeah, that's an interesting question. And as you said, yes, we like to think that. So there is an interesting, so for your audience as well, so let me just go one step back. Beginning and even mid-past century, so medicine was very different. It was much more in terms of comforting the subject, trying to do few things. There are not many things that you could do for patients. So it was a different profession. And then as the drugs, there was this big development with drugs. Now, then the second wave of development with medical devices, and then with different procedures. So medicine has changed significantly, and that's how the evidence-based medicine came, because now there is actually real evidence. You also have at the same time development of better techniques and better methods for clinical research, for clinical trial, meaning for testing drugs, testing medical devices. So, and that's the thing that's what happened with medicine. So the collection of the data improved, there was new development of drugs, and development of medical devices, and with all of that, then medicine has changed it for, instead of being based on a physician's own experience, was based on real data. And the internet also helped a lot with the evidence-based medicine. When I was in medical school, so if you wanted to check for papers, if you wanted to check for articles for that particular disease, you have to go to the library. To read one scientific article, you need to go to the library, period. And you need to wait, about an hour to get the journal and then to read it. And then you realize, no, that's the wrong article. Then you need to get another one. So you see that the access to data was very different as well. So I think the evidence-based, that's why there's a big increase in the evidence-based medicine. And I saw during my medical training, because there was after the internet, then you could go to PubMed. PubMed is the, for your audience, is the database where you search for the scientific articles related to medicine. And you could go to this website and you can search and you can see 25 years later, then internet was more accessible. So then medicine has changed significantly. And then that's why we call evidence-based medicine, and it's now more established.
So it sounds like evidence-based medicine deals a lot with research and looking at what we've learned previously about a given situation. So here we are in 2020. We're all self-isolating to protect ourselves from a global pandemic. And so I wonder, how do you apply evidence-based medicine to an emerging disease like COVID-19?
Yeah, that's a good question. That's something I've been discussing with my students in my course at the School of Public Health. And the main question is, should we change the standards of evidence-based medicine when you have a pandemic? Meaning, there's a standard for the minimal evidence you have to have it before giving the treatment to a patient. And just being very general, so you need a certain number of clinical trials, studies testing for the drugs, and you need a certain evidence for that showing that the drug is better than, for instance, for placebo. Okay. And the question now, has been, should we lower those standards so with to a lower level of evidence to use those interventions? Again, I think that's a tricky question. I'm not, I don't think that is a solution that do not bring harm as well. And I think that's an important thing to consider.
So I assume some of the data that has to be collected is about diagnosis rates, rates of death and whatnot. So can you talk a little bit about how we are currently collecting those numbers, what the challenges are, and how we might be able to do it more quickly?
There's two things here that I think that's important to emphasize. So one is the method of collection, meaning the diagnostic test. So for instance, you can collect for COVID-19, you can collect the viral load, meaning the active virus. The other important thing, besides of what you're collecting, is what you call sensitivity and specificity of the tests. What does that mean? So sensitivity is whether you can detect all subjects who are infected. And specificity is that for those who you detected, how many have the disease? You see, so these two things are important. So you want to detect as many as possible. However, you also don't want to detecting anything. So let's say you do a test that detect any viral protein. Then you start getting people telling that thinking they have COVID-19, but they have actually flu, they have other cold virus and so on. So, but also if you do too specific, you may also lower the detection rate as well. So that's all those things that's important as well. So at the end of the day, when we see the number, we need to see what's the technique that's involved. And I think that's an important thing, that sometimes this message, this detail is lost when you read the news on the newspaper. And I understand it's difficult to put all this technical information in a news story, but that has a big impact as well, how you read. All of these is challenges. So when you read the final numbers, you need to see the whole picture, how the data was collected, then to make conclusions. So that's one thing that is difficult as well for understanding the information, for critically analyzing the information.
So it sounds like a healthy skepticism is important to understand that our data may not necessarily be representing the full picture because of the limitations of how the data was collected. And I assume it's important to have these numbers accurate for safety, among other reasons. And so along those lines, with so much pressure to produce a vaccine quickly, what measures are in place to ensure the safety and quality of that vaccine?
So we do have a good knowledge in terms of testing vaccine. And so I think that's number one. The issue here is that, as I discussed in the beginning, is how much we speed up that process. It's fine to speed up the process, but not to jump steps. We can't jump steps, because if you do that, there's a risk that at the end of the line, we'll have a vaccine that, one, is not efficacious, and two, may lead to adverse effects. I think that's the important risk to manage. And two, if we're doing, if you're testing vaccines without knowing too much about the mechanism of this virus, there's also a risk that we spend a lot of effort and funds developing something, again, that will not be effective. And then we get in the end of the line and say, look, now we need to go back to the beginning again. We should be careful of having this certainty that, yes, in 1 year and a half, we'll have a vaccine. I wouldn't be that certain. It does seem that some targets were identified and they see potential good targets for the vaccine. But I'll just be careful with that. I think at the same time, we need to develop plans for not having a vaccine in 2-3 years, or in 2 years, or in 1 year and a half.
So obviously a vaccine is very important to help us return to normal. But there's, it's not just people who are patients of COVID-19 who are being affected by this pandemic. And so I wonder that in addition to a vaccine, what other types of research is it important to conduct during and following a pandemic? For example, research into mental health, the concerns about isolation, impact on essential workers, that sort of thing.
So I think all of these are important, and that's exactly as my last point in terms of the vaccine. So yes, we should put a lot of effort on that. We should give time to develop vaccine, but at the same time, we should exactly look at the other aspects of the disease, meaning that, research on decreasing transmission, research on other aspects as well. So such as you said, if isolation will become a norm, or at least relative isolation, let's put it this way, in few months from now. So what is the other aspects that need to be dealt in terms of mental health? So at the end of the day, research is very much driven by funding. So, I may have wonderful ideas, but if I have no funding, it is truly impossible to test it. So I think this, this notion that, yeah, I have a wonderful idea and I'll develop myself on the weekends and evenings. I can develop the idea, but at the end of the day, you need to test it. And it costs money to test. So there's no way of truly developing and testing an idea without funds. So at the end of the day, again, government and foundations, donations, so on, is what's going to dictate the agenda, the research agenda. And that's one thing, again, and hopefully there is a sensitivity to that for doing research in other aspects.
Would you be able to talk a little bit about how doctors and healthcare teams are teaming up around the world to fight this by sharing information?
There have been some initiatives. Of course, let me discuss some. So one is WHO has created a nice website repository for collecting different scientific papers, organizing that information. I think last time, I'm trying to remember now the numbers, so 10,000, 15,000 new articles or articles on that. That's one initiative. The other initiative as well, it's been happening. There is one issue when you write a paper, and that's why I said as well, it takes some time in science, because you collect the data, you have to analyze the data, you write a paper. When you write the paper, you submit it to a journal. When it gets submitted to a journal, before getting published that people can access and read, it needs to be assessed by what we call peer reviewers, right? So people with knowledge in the area that will review and will send the comments to the author. The author will address the comments in the article and will send it back. And the peer reviewers would check whether that's okay. And if everything's okay, the article gets published. So as you can see, that takes 2-3 months sometimes. And this time is being cut, is being shortened. But it still takes some time for the paper to get accepted in the journal. So what's been happening is now there is a big repository for papers on what you call a preprint status, meaning without the peer review, meaning you submit it to a journal, but the information is so important, you want to release the information with a disclaimer. This has not been assessed by peer reviewer. So that's another way that's it's interesting. It is being more used and is helping as well with the spread of the information and the collaboration. So I think at the global level, those are some examples that I've been seeing. But at the same time, so since a few years ago, there has been movement in terms of sharing not only the papers, but the data as well. But there has been a movement on that. And now it seems that maybe COVID-19 will speed up this as well. So more researchers are sharing the individual data sets. So you can access that and you can do your analysis. Maybe you find a different association, a different correlation. So that is happening as well. So I would say those are the few initiatives that's been going on to help.
So you mentioned earlier that the news media may not be able to, or isn't really able to, dive into technicalities and specifics. And I know from previous events that the news media tends to sensationalize things and go for black and white, quick answers and whatnot. And that has unfortunately led to a lot of misinformation being out there, both that and, of course, social media and people spreading whatever information they want. So I'm wondering if you want to take a moment to address any major misconceptions about COVID-19 that you're hearing going around that you'd like to correct.
The chloroquine or hydroxychloroquine for treatment of COVID-19. So the story of chloroquine is that this drug has an antiviral effect in vitro. What does that mean? It means that you get the drug and you, in a separate experiment, not in the human body, you see that the virus, they don't replicate. so that's what we call in vitro, outside a human body, for instance. So the drug inhibits viral replication. So based on that information, that there is a number of steps to human biology. They say, look, maybe chloroquine would be effective for COVID-19. And then there is one report saying that, oh, there's a trial that shows positive effect, but without the details. So based on that, then there was this misconception, and I think that was wrong. Oh, chloroquine does work for, or may have it. I forgot the exact words that they put it, but it work, or it has a great potential, so on. And of course, the social media picked up that and started spreading that information. Be careful with potential cures, potential treatments without being fully tested. And I think chloroquine was an example. And now it has been shown that the drug may even have actually a detrimental effect for COVID-19. So, we should be careful because there's a lot of unknowns.
So with so many unknowns out there, how do we know what to do, or how do we know how to move forward, or when will we know?
Sure. Yeah, that's a difficult thing. I think there's different ways of, and there's a little bit of a risk analysis, risk-taking approach here as well. So, if you don't know, you can go one extreme of trying everything, but that's not what we are taught in medicine. So again, the Hippocratic oath, first do no harm. And I think that's the same thing here as well. So, I would say, in my view, is with that many unknowns, again, there's no way but it going one step after the other, being careful, analyzing the information, trying to gather as much information as possible, and again, being careful.
Is there anything additional that you'd like to share that we haven't spoken about, or any parting thoughts or words of wisdom?
One thing that I've seen is that good ideas and human inventiveness, it's something that we all have it, and there's different ways of sparking that ability, and sometimes it is in moments of crisis that it sparks these big ideas as well. So I think at the end of the day, I'm confident as well, either one way or another, but human inventiveness will address all the problems we're having.
Excellent. Well, thank you for ending us on that note of optimism. And thank you for sharing your perspective on how important it is to think critically and be skeptical of information that we see, and even information that comes from science, that science is not, the science so far has not had the time to prove itself trustworthy. So thank you for encouraging our skepticism. And thank you again for taking the time to be with us today. I hope you and your family and your loved ones can stay healthy in this challenging time.
Wonderful. Thanks so much, Alex.